giving heart failure patients better chance and more access to doctors and the therapies they need.
A revolutionary new AI-powered technology is doing just that for doctors, clinicians, and patients at the Christ Health Network. And WLWT News 5 anchor Ashley Kirkland joins us now to show us how this AI tool benefits healthcare professionals, patients too.
This is really cool to learn about, guys. The Christ Health Network has been the first in the country involved in this partnership with medical device company Ancora Heart and Ignite, a leading cardiovascular care digital health company, for this trial of its AI technology. Now, the new tool is designed to deliver innovative, potentially life-saving therapies to patients experiencing heart failure faster than ever before. Chances are you've used some sort of AI system like ChatGPT to make a grocery list, help formulate a resume template, or even to organize details of a vacation you're going on. But if we take a peek into the world of cardiovascular care, artificial intelligence partnered with human intelligence is being used to enhance and save lives.
AI has a lot of different connotations to different people, and some of them are negative, but this is a hugely positive application of artificial intelligence to help look through medical records, and more than that, to integrate what have been traditionally different silos of medical information, like your electronic health records.
Chairman of the Christ Hospital Heart and Vascular Institute, Dr. Dean Kyriakis, has been using the technology for about a year, getting patients into clinical research trials.
And when we were looking to get patients into clinical trials that had certain clinical characteristics, but also certain imaging characteristics, it was very challenging and time-consuming.
Before this technology, clinicians like Emma Reese had to screen the patients manually to find viable candidates for clinical trials.
When I was just looking through every heart failure doctor's schedule, I would look all day and maybe find one potential, maybe find none. It was not very productive.
Now, Reese uses the tool to narrow down patient populations based on criteria for the studies to find patients that might otherwise be missed.
Maybe they just see a general cardiologist and they have heart failure, and that cardiologist isn't thinking about research necessarily. This is a good way to find those patients.
AI-powered predictive algorithms automatically cross-reference patient characteristics with screening guidelines to identify patients who qualify for different therapies, ranging from medications to heart valve interventions and more. Reese shows an example for one study that starts out with a generic screening of 1,200 candidates.
This first one's just an important measurement for the study, and that's already taking out 557 patients, and eventually gets narrowed down to 333, which is a much easier number to work with than over 1,000.
She's able to do in 1 hour or 2 hours a week what it could have taken her 40 hours a week to do.
Dr. Kyriakis says screening patients for CardioCare research doesn't even scratch the surface of the technology's application.
Diabetes, same thing. We can go through our database and we can see who's well controlled, who's not well controlled, what medications they're on. High blood pressure, the same thing.
Well, as a hospital that participates in FDA approval testing, the Christ Health Network is the first site to use the trial accelerator AI technology. This technology will roll out at other healthcare sites in the near future. Ashley Kirkland, WLWT News 5.